Hey guys, so good. Oh my goodness, I did it already. I said, hey guys, and my mom told me not to do that. She is a stickler for using correct English, so I'll say, greetings all. Sorry, Mom. So before everybody gets here, I'd like to go over the things for people who are watching this after the live broadcast, and that would be telling you how to make sure you don't miss these in the future, because so many people are disappointed when they miss us while we're live. So the way you do that is you go on YouTube, you find the Auburn Medical Group channel, you find the little bell icon, you tap it, set up your notifications, and then go in your settings on YouTube and set them so that you'll get notifications when we're live. Also, it probably helps if you follow me on Twitter and have notifications on there. It's at Dr. Vaughan. Okay, people are joining us already. I need to say howdy to Butterfly Girl and hi to Darla Cruikshank. And LPSLP is a big fan, is also happy to be here live with us as we talk about Dr. Gawayne's inaugural post on his blog, which is called Dr. Green Knight. That comes from Dr. Green Knight, or not Dr. Green Knight, it comes from the Green Knight, which is what they call Sir Gawayne, the knight in the tales of Lancelot and King, what's the name of the king? Somebody help me. Can't come up with it right now. Anyway, Arthur, King Arthur. King Arthur's Knights of the Round Table. One of them is Sir Gawayne, the Green Knight. So that's why Dr. Gawayne calls his blog drgreenknight.com. And BooBoo Kitty. Howdy, BooBoo. I just had a message with BooBoo Kitty because we were setting up for, it's Wednesday night that we're doing our Google Hangout, because people who are on Patreon for the Auburn Medical Group, if they're at a certain level, they participate in a monthly Google Hangout with me, and BooBoo Kitty does that. Okay, let's get caught up with the comments while I was talking. Oh, also, a little housekeeping here. If you guys want to get your comment through and get it noticed and addressed, just use Super Chat, where you use the little dollar sign along with it. That'll get people's attention, and certainly we will address whatever it is you ask or talk about. Of course, it may be that I tell you I don't practice medicine over the internet if it's too personal and it's asking about your own personal things. But we do talk about medical subjects. Jose Sanchez, hi. Thank you so much for participating. Norma Jean Green, a return participant. Good evening to you too. Tracy Glenchy from Australia. That's amazing. People from Australia are watching this as it's getting to be after sundown, approaching twilight here in California. His sibling, boy, you have been just all over everything we've done this weekend. Good evening, and thank you for your great comments on the videos this weekend. Jose Sanchez, I'm doing great because I get charged and excited when I do these live discussions with, right now, 44 people all over the world, 42, all over the world. It's just amazing what YouTube and Google allow us to do. Hi, Judy Dukes, and Nando Rocks has a question about Xarelto that many East Coast doctors avoid. They're avoiding Xarelto, and I don't know why they're avoiding specifically Xarelto and not other, what's the word for it? Novel anticoagulants, meaning anticoagulants do kind of the same job as Coumadin or warfarin without having to get your blood tested every month. I don't know why they're avoiding it. I am a fan of Xarelto, and Xarelto has some indications that some of the other newer novel anticoagulants don't have, and I'm trying to remember off the top of my head what it is. I think it might be either pulmonary embolism or deep venous thrombosis. These are drugs that keep your blood from clotting when it shouldn't. And so you use that in situations where somebody's blood is clotting when it shouldn't. And so that's things like people who have strokes or heart attacks, or, well, actually it's not indicated for stroke, sorry. We don't have data to support it there. But it is used in people with atrial fibrillation. Atrial fibrillation is a condition where the heart doesn't beat in a coordinated way. The muscles just kind of fibrillate is the word, like a bag of worms as people sometimes describe it. So the muscles are just going by themselves. It's not coordinated to pump blood. They're just kind of wiggling there. And then this bad rhythm called atrial fibrillation sometimes happens. Blood doesn't get pumped quite as hard, but usually that's not much of an issue. It's just like a little 15-20% extra little kick. And some people won't even notice that it's missing. But what can happen is, because it's not beating in a coordinated beat, a little blood clot will get caught in there or develop in there, which is fine as long as it stays there. But once the heart starts beating in a coordinated manner again, it'll get pumped right out and go to either the brain or the bless me, sorry about the sneeze, either the brain or go to, it could go to the lung, and cause a pulmonary embolism, stroke in the brain. So we put people on anticoagulants when they're in that atrial fibrillation. And it can be any of these novel anticoagulants that are taking the place of Coumadin. The problem is they're new and so they're expensive, but the wonderful thing is you don't have to test all the time for them, although that doesn't offset the cost enough. But it's sure wonderful for a patient not to have to go in and get their Coumadin checked every month and get that, see if it's within the limits. And the reason they have to do it every month is because it just goes up and down and up and down. The value of what's called the INR, which is a way of measuring how adequately the blood is kept from clotting when normally it would clot. Problem, though, of course, if somebody is in a situation where you should have your blood clot, like if you hit your head on the ground because you tripped and fell, and so now you've got this bleeding under the skull, you want that to stop bleeding and clot, and so these medicines can result in death in certain situations, catastrophic bleeds, or from the GI tract if somebody has a GI bleed. So there's danger with them. In fact, warfarin, I think still is used as rat poison, although there's a lot of resistance to it, so now they have something called super warfarin. So we are literally prescribing rat poison to our patients. It's kind of scary, and that's why you have to have those blood tests to make sure it's within those levels, because it is so easy for it to get knocked out. It's acting on what we call the vitamin K dependent clotting factors, meaning they need vitamin K to work. And so when it's doing its job, if somebody eats some vitamin K, which is in your green leafy vegetables, it can actually affect the level. So we tell them, eat a constant level of vitamin K, and we'll adjust it according to that. Some people are under the false impression that they're supposed to avoid vitamin K, and so if they normally eat it, they try to avoid it. That's a problem, because then if they do get some in their diet because they weren't aware of the foods it was in, for example, then it really throws things off a lot. It's better just to eat a constant level. Go ahead and eat the amount of spinach you normally would, and we'll adjust to it. And oh, Lisa's here. You guys like Lisa? Who wants to be on the video here with these 30 or 25 people? Oh, look, it's one of my fans here. We've got Maggie and Lisa. Oh, we've got more people coming. Who else is going to be on the video? Is this Dana?
Yes.
Dana's here, and Grace. I came up with it before you said it. Grace here, Dana here, Maggie here, Lisa here. Oh, who else is here? I'm sorry, I forgot your name. Katie? Yeah. Katie, come on in if you want. I mean, it's up to you.
What are they saying?
Hello,
everyone. Hello, people.
I haven't been keeping up with the comments. I was going off on one of my talks. Not a rant.
Oh, I love when you did
but
that.
Just a talk. Okay, yes. So, yes, here's Maggie and Dana and Grace and
we
Lisa.
All just graduated high school.
They all just graduated high school.
So we're legal.
Oh, my goodness. You know that Grandma watches this, right?
Hi, Grandma.
Hi, Grandma. Hi, Grandma.
Gee. Okay. Awesome. Oh, of course, BooBoo Kitty would.
BooBoo Kitty.
Yeah, you guys know her, right?
Oh, yeah.
She's right here, surrounded by beautiful women, Dr. Vaughan. Yes, I am in paradise. You guys already know that, though.
Yes.
Thanks for participating, ladies.
Bye.
That's pretty cool.
We're trying to get that every day.
Okay, so I think we're about done with the talk about Xarelto and the novel anticoagulants. I keep touching my head here because it's that time of day that the mosquitoes come out, so I'm kind of paranoid. The mosquitoes touching me. All right, we'll go back. I'll try to get caught up with old comments, but also be aware of new comments at the same time. And Regina, yes, go straight to college. We want them to. And Dolores, thank you for giving congratulations. Nanda rocks. Didn't catch up on what you said there. Civics, just into my freshman year. Sorry you had a bad year. And Darla Cruikshank saying hi to the ladies, having lots of people over. And congratulations to the ladies. Yes, they all graduated from high school. Regina saying yay. And they are pretty. Lisa Durkin saying hello to the crowd. Other people saying hi to Sharon and Jose. Nanda. Everybody saying hi to everybody here. Mary Angelo, everyone. Tracy saying hello. BooBoo, hi Lisa. Okay, so that must be when they came in. Regina's mom is on Eliquis, which is one of those drugs. Eliquis and Xarelto. Yeah, those are two different ones. See, I always get the generic names mixed up when they're new, and these are relatively new medicines. Darla's brother-in-law is on warfarin, so she can see what that's like with him having to go in for those monthly blood draws. Nanda rocks, yes, almost died with Coumadin, stroked at, oh my goodness, Nanda, I'm so sorry. Have the prothrombin genetic mutation. Coumadin is affective, I think you want effective, and non-therapeutic. I've been on Xarelto, so I hope Xarelto is doing a good job. So what she's talking about is one of those things we test for when somebody has a blood clot inappropriately. We're kind of scratching our heads going, why did this person clot? There wasn't some kind of a reason for it, like they just had surgery or they've been immobilized, had an injury. Pelvic surgery is one of the big ones that we have to protect against it. And we'll do some blood tests, and apparently she had one of those mutations that we test for that she's just more inclined to get clots. Tracy is saying it's winter here, so no winter. Wait, you're in Australia, so actually it is winter there. Unfortunately, I'm homesick with chest infection. Many people getting sick at work. I'm sorry. Super chat. Where? I'm sorry. Everybody, I'm going to go. Thank you, BooBoo, for catching that. You are right there on the super chat. So I'm going back and looking for it. I do not want to miss that. And I did say that I will give super chats priority over everything. And are you sure, BooBoo? I am looking for it. Or are you telling her to super chat? Because I think that's what it was. I think she was telling her to super chat. So, Regina's mom has a fib. Judy's super chat. No. You're telling her what the $sign at the bottom is for. Yes. Okay. Myotonia. Probably not going to hit that tonight. Civics. Make friends. Junior year. Lost a bet. Now must wear High School Musical backpack. Bummer. Did you have a patient that flipped out on you? Yes. I left the room, caught my breath, caught my cool, went back in. I was a little nervous. Patient was wondering why I ran out of the room, wondering if I thought that they were going to hurt me. Yeah, I thought that was a possibility. People sometimes do that when they flip out. Jose is a big fan. Regina, go straight to call. Okay, yeah, we caught that. And getting back caught up to what was going on before the ladies got here. I think we went through all that. Oh, now decrease output in PVTs, premature ventricular contractions, as we're part of the heart beats prematurely. Gives you a little extra skip beat that you feel, and then your heart has a compensatory pause after, which is really what you notice more than the early beat. You notice the pause after. Okay. Oh, mom is on Eliquis, brother. And Nanda, story. Did you ever have a tick on you? No, I check every time I get out of the canyon or go hiking. Still haven't found one. We went on top of the hill behind my parents' house. Didn't find any there. Wouldn't let my dad take Xarelto. BooBoo, you wouldn't let your dad take Xarelto? Would you rather have him on Coumadin? Or was it too expensive? Bailey Johnson, hi from Austin. Hi. Norma Jean Green, bless you. God bless you. Bless you. Oh, well, that must be when I sneezed. Xarelto AFib ablation success. Yes, sometimes you can make AFib stop with ablation, which is where you use electrical current to kill off part of the conduction system that's causing the circular conduction of the electricity. You stop it, and then it goes back to normal. Do I have any pets? Yes, I do. Have you heard of my Toronto, Ontario? That's where you are. Okay, thank you. And I just know you're somebody's sibling. I don't know your name. Pat Smith from Houston. And Paula Largent says, cool. It's strange when you go through them backwards because you don't know what people are replying to. Patient flipped out on you, yes. Edmonton, Alberta, Cruikshank, thank you. Mary Ranch, hello again from Michigan. Hello, Mary. Jose saw this channel a week ago. Channel's awesome. I agree. I'm totally there with you. Lisa Durkin, hi there, Doc. Debbie Shrewsbury, which is the name of a little burg outside of St. Louis that we used to live very close to. Could you subscribe me, please? I have questions. Okay, so now we're going to hop back up with where we are. And no, there were no super chats. That was just a false alarm. But BooBoo, thank you for telling her what super chat was. We would want Tracy to feel better. So, Jose, my brother had the flu overnight. Didn't know what to give him. Regina, talking about her mom with AFib, needed cardiac MRI. What are they looking for? I'm not familiar with cardiac. Oh, I need to close the door. The air conditioner's running. Hold on. Okay, I'm back. Sorry about that. The air conditioner's running and the girls left the door open. And anybody who has children can relate to that one. Okay, how do you super chat? When you put in your comment, there's a little $sign there. You hit the $sign, and then you can give a certain dollar amount so that your comment really, it's cool. Anyway, I don't know if you can do it on iOS yet. Oh, hey, Petra. Petra at 5:30 a.m. I guess it's time to get up. Sorry if I woke you. Darla Creek, 9:30, and the sun is still up. Trying to super chat with difficulties. Nanda rocks. You get it, and we will respond to it. Michelle Walker, hi from Phoenix. Hi. Mary Francis, hi from Greenville, South Carolina. Doc, are you making any more videos from work? Really enjoy how you care for your patients and they love you. Yes, absolutely. Today we did something a little different. I actually went to a patient's house this afternoon and got a little bit of video about his upcoming proposed gastric bypass surgery, and got video of kind of why he's getting it, showing what it's like when he tries to get up from a chair, when he tries to walk. And that's going to be kind of an ongoing project. I don't know how soon it will be that we get any of that actually out for you guys to see. We do have a video coming out tomorrow that was from the office, and it is on a shave biopsy, but it's really, instead of being so much about the shave biopsy, it's actually more about the decision-making process between Dr. Gawayne, myself, and the patient. All three of us together are on the video kind of going over it and explaining pros and cons for various options to go. So I really wanted to show you what it's like when I asked Dr. Gawayne to come in the patient exam room and help me with advice on what to do with the case. We do that for each other. Seem like a cool doctor. Yes, you can seem like anything on TV. Wasting bot air, as say in the South. Did you ever get sick from a patient? Yes, I did. When I got that cold that lasted for 2 months, it just went away. Last mosquitoes are out. Okay. Nanda rocks, if you do get that super chat going, we will totally know. An angry face. You don't do cardiology, but what could they be looking for with the cardiac MRI? I'm really scared for her. Cardiac MRI. Okay, so cardiac MRI. Now, there are things that do something similar to MRI, but they're not actually MRI, looking at the heart. And usually what you're looking for are areas of the heart that are not either getting metabolism, not metabolizing a form of glucose that you give it, and it lights up because it's got a little radioactive tag on it. So it's kind of like a dead part of the heart you can see. Cardiac MRI would also be used if you're looking for a tumor in the heart. It would also be used for, what else would you use it for? Certain kinds of muscular disorders of the heart where the muscles aren't working right. That would be another reason you'd get a cardiac MRI. Never ordered one, so I can't tell you much more than that. Heidi Steinbeiser, do you think flu shots really help? Absolutely. The evidence is overwhelmingly positive that flu shots keep people from dying. I wish I could tell you the numbers off the top of my head. Now, there are some problems with the numbers as far as, well, how do you compare one year to another, and how do you measure? What you do is you look at people who have flu shots versus people who don't, and how many of them are dying. And it's usually the elderly people. These are like nursing home residents where we're really seeing the difference. And yeah, it's death. It's people dying that we make a difference in. Now, for people who are young and healthy, in their 40s, and they don't have health problems, and they get it, it's probably not keeping a lot of those people from dying, because not a lot of those people die from flu shots. But here's what it can do for you. If you would have missed, I did get it. Look at that. Can you guys see it? It's on my finger there. Totally got it. Congratulations to me. Now I'm going to go wash my hands. Yeah. Somebody who's young and healthy gets a flu shot, doesn't get the flu. Well, that's possibly like 5 days of work that you're not missing. Nanda Rocks got it. $2. Got that super chat. LOL. Lol. I always try to come up with an alternative for lol other than laugh out loud. But I'm slow tonight. I can't come up with it. Somebody else give me an LOL other than laugh out loud. Okay, so Nanda, you're the best. You are the star of this chat, of this. You are our hero. Everybody appreciates you doing that. Everybody tell Nanda how much you appreciate her doing that, because we all benefit from it. Because if I'm getting some incentive from doing this, and you guys enjoy what's going on, then, it works for everybody. So everybody's happy about it. All right. Go back and get caught up here with what happened. Heidi has a question about autoimmune disease. Diseases on immune suppressing drugs. So my doc says I need a flu shot each year. Yeah, I'd recommend it, because when you get the flu, it's not the same as what I said earlier when I said healthy adults with young adults with no health problems. You're the exception to that. Okay, Nandrox, sorry. At work, can't check that debit at work, but hey, such is life. Wayne Thomas, what did you say, Wayne? Intermittent short-term memory loss, any ideas? Did anybody else see my intermittent short-term memory loss? Yeah, it's probably not anything more than what I'm suffering from. If it's worse, you have to kind of do some testing. Your primary care doctor can do something like a MOCA or a full steam mini mental status, just to kind of do some screening there, or a mini cog. These are just tests that we do. I do one of those tests every day on a patient. Let's just say that. All right, getting back caught up. Paula Largent, if something abnormal is seen in an egg, and they're sending you to a neurologist. Oh, I'm sorry, not egg, EEG. Sending you to a neurologist. Egg, that would be a obstetrician. What would they be looking for? EEGs just don't show a whole lot. I mean, they can show like an area that's depressed because it's not producing normal activity. They can show an area that's excited because it's showing seizure-like spikes. But it's not specific at all. So if they saw something other than just textbook normal, oh, let's send them and get them evaluated because we don't know what it is. The real question is, what are they doing it for in the first place? And that's what's going to need to be evaluated. But generally, it's for looking for seizures. Lip slip, did you ever get extremely sick that you almost died? I did not. Thankfully, no. I've never been almost died. League of Legends, yes. League of Legends for, oh, shoot. I can't believe I forgot her name. Nanda rocks. Can't believe I forgot that. See? Is that short-term memory thing? I forgot Nanda's name, and she even gave us money. Sharon Calvert, lots of luck. There's another one. Do you know anything about Tourette's syndrome? Tourette's syndrome. Yeah, I do. Jose Sanchez, sore arm from baseball. Will icy hot work? Try it, see. Petra Rosenberg, you need to go back more. You mean like through the comments and get caught up? Can you guess how old I am? Not old enough to be on here. I'm a polysomnographic technician. Well, she could help us with the EEGs, I think. Wait, no, you don't do EEGs with those. You just do respiratory and pulse ox and some other measures. And they'll do those on people when they're checking them out for like sleep apnea. Cash for AZ, I guess it's Arizona. Thanks for the advice yesterday about the tetanus shot. Going to the doctor tomorrow. Thought it was good this morning, but the fever came back around noon. Hopefully it's just a benign reaction to it, but we always check, to make sure like it didn't get some bacteria in there or poke it all the way into the bone and cause a bone infection. These are unlikely, but being that I'm on this end, I have to cover my bases here. Paula, thanks. Nanda, sleep studies, yes. Jose Sanchez, sophomore in high school. Want a job shot of a doctor? Just ask. Ask your doctor first. Start there. Send out some letters. Regina, no patients with... Regina, I'm so sorry. No, I have not had one. I'm totally honest. I don't know. Okay, talking about these weird patterns of having patients with different things at different times. Here's an example. I treated bacterial vaginosis Friday and today, and I don't think I've done it in the past 10 years. Just all of a sudden, 2 in a row. So it happens. Nanda's doing the CPAPs, BiPAPs, and checking for insomnia, studying for narcolepsy because she does the sleep studies. And we do order those. Petra, I'll say, yes, I think that helped. Okay. Actually think I got caught up with you guys and the super chat from Nanda. Nanda being this live YouTube with Dr. Vaughan is brought to you by Nanda Rocks. There you go. Thank you, Nanda. That was pretty cool. Got that super chat. Lots of love. Lots of luck. Okay. Have I ever performed surgery? We do weekly, almost weekly on this channel. You can just watch. Look at other videos on this channel. Prescribed Flagyl. That's right, Regina. I did prescribe Flagyl for that because that's the first line treatment for bacterial vaginosis. Okay, I'll tell you guys a little story. In high school, we would play against another high school called Bella Vista. If anybody's from Bella Vista, forgive me for what I'm about to say. I love you. I love Bella Vista. It's a great high school. My kids compete there, and we go there for, we went there for sections for track last year, I think. Bella Vista, okay? Bella Vista High School on Madison Avenue. So we'd have these rallies for, whatever, the football team, basketball team that's playing against the other school, and we'd say beat, and then you say the name of the school, like beat Colfax, or for Bella Vista, we'd we'd abbreviate it to its initials, BV, beat, BV, beat, BV. Well, this came back to me, this memory of beat, BV at the rallies came back to me in medical school when we would discuss Gardnerella, bacterial infection of the vagina, often called bacterial vaginosis. and found that in the medical world it's shortened to BV, and you want to beat BV. We treat it with metronidazole, beat BV. So, of course, I was taken back to Bella Vista rallies when we play Bella Vista. So that's my story about bacterial vaginosis, and sorry anybody who goes to Bella Vista. Your cousins live there? Went to Bella Vista? Good high school. Don't think any less of it because the initials are the same as Gardnerella. Okay. I don't know. I'm Marlis. Oh, you are Marlis. It says it right there, Marlis Elves. And Teresa thought it was funny. Bailey Johnson got in C. diff from having BV so much. Wow, that's awful. Okay, so let's go over some ways to not get bacterial vaginosis. Don't douche. Do clean yourself regularly. Have good hygiene. Don't wipe from back to front after going to the bathroom. Wipe front to back. These are things that may be able to help somebody keep from having a repeat episode of bacterial vaginosis. Pink fluffy unicorns, dancing rainbows. Bella Vista, California. No, it's actually in Sacramento. Look up, doctor. Look up. Why is there? You looking at my chin? Somebody have a drone? Oh, in Brazil. Mariluz. We are so glad to have somebody from Brazil participating. Vagisil, okay. Don't put anything in. Don't mess up. Yeah, don't put anything in there. Yeah, taking the antibiotics messes it up too. Should I call my teen and get her up for this talk? Maybe if she needs to follow this advice in order not to get a non-sexually transmitted vaginal infection is what bacterial vaginosis is. Obrigada. I don't know that word. Is that Portuguese? Jose Sanchez, watching all the way from MacArthur, California. 4 hours from Sacramento. Cool. And, oh, look down on the comments. All right, what are we looking for? Are we looking for another, did I miss another super chat? Oh, Petra has something sad to say. Oh, Teresa, your first live chat. We are so glad you made. And then we've got Morales, amo sus videos. Thank you. He was saying he loves my videos. That's Portuguese for that. Bella Vista, California. No, my cousins. How funny. Okay, somebody was going to say something sad. Boy, it's really getting dark here. Look up. I did. On the comments, I did. You said you're going to say something sad. Oh, hi to Zach. Zach Safford Vlogs. I have to get colposcopy. That's actually where they do a way of magnifying the cervix, not magnifying the cervix, magnating the view of the cervix during a pelvic examination, so they can look for spots when somebody's had a bad pap. Usually find the little precancerous spots and freeze them or cut them out. Hope that goes okay for you. What's a super chat? That's where people give some money with a little dollar sign when they give their comments. Brazil, Bahia. Zach says, I'm awesome. Thank you. Appreciate that. LPS. Click that dollar sign. Give the doc money. Yeah, Nanda knows how to do it. Sacramento, California. That's correct, Mary Francis. Vagina self-clean. That's right, BooBoo Kitty. That's why we are against douching. You don't need it. The body takes care of itself. Okay, Petra, I'm sorry. I'm just not getting whatever it is you said you had some sad news, which makes me sad to hear you say that. But I'm not. You have something to say. Okay, I don't know what Petra is going to say. Why does Petra get so much attention? She's on Patreon, that's why. Regina, you're okay, Regina, don't worry about it. Jose, I look up to you, Doc. Thank you, I appreciate that. Regina, Jose, want to be a doctor or something? That'd be awesome. Okay, you knew the tumor they took out of the hysterectomy? That was oh my goodness, Petra, I'm so sorry. So cancer in the uterus they took out, did they get it all? Was it all contained in the uterus when they took it out? That's something we really want to know about that. Lisa doesn't see a dollar sign. It could be that you're on an iOS and that they haven't integrated into the iOS yet. Zach, I think I have paronychia on my finger. Whoa, what will cure it? Well, if it's paronychia, draining it. Wish Dr. B worked in North Carolina. We've got beachfront property outside. Yes, BooBoo, we're giving hearts to and love to Petra. Absolutely, and praying for Petra. She's been through a lot. Those of you guys who don't know, she's been through a lot with this hysterectomy and the infection afterwards, and just not getting better, having to get readmitted. Omar, hey, Omar. Oh, Omar, yes. I responded to your message today. Love to Petra. Sorry to hear that, Petra, from Tracy in Australia. Okay. Thank you so much, guys. We will be continuing to think of Petra, support her, pray for her. And I will be kind of signing off for now, but I had a great time with you guys. You guys, actually, it's the only person who's, I'm sorry, I keep saying you guys. I know it's a mixed gender audience. Please forgive me for that. And my mother, if she's watching this, Mommy, please forgive me for saying you guys again. I'm working on it. Okay, I was going to say, the next time I'm doing something live will be Wednesday night with certain members of, actually it's just BooBoo Kitty, on Patreon. yes, you guys, absolutely. Prayers for Petra, night BooBoo, all of you guys. Until next time, Dr. Mark Vaughan.